The word bicep means two heads because there are two places that the bicep attaches. Up top at the shoulder called proximal and the other attachment at the elbow called distal. A torn bicep occurs at either of these locations and the treatment is determined by the kind of tear. The proximal bicep has two attachments, one into the shoulder joint and the other to the front of the shoulder blade. These two attachments are referred to as the long and short head of the bicep. By far the most common bicep tear is a proximal long head rupture in the shoulder. This type of injury presents while lifting or carrying something heavy, often overhead, where you may feel a rip or tear and often get bruising down the front of your shoulder. You could also develop a Popeye deformity, which is a bulging of the muscle itself near the shoulder and a change in the contour of the bicep. A similar injury that occurs at the elbow is called a distal bicep rupture, which typically happens while carrying or catching something heavy or with lifting. You'll experience bruising and pain centered around your elbow, and you may also experience a Popeye deformity close to the elbow. These bicep tears are actually two very different things. A distal tear at the elbow is more of a surgical urgency, and most often these tears need surgery and do poorly without it, whereas a proximal bicep rupture near the shoulder is more typically treated without surgery and with supportive care, physical and occupational therapy, and observation by your doctor. Regardless, it's extremely important that you're checked out by an orthopedic specialist, as 40% of bicep ruptures will be accompanied by a rotator cuff tear. Often when patients present with a bicep rupture, we'll get an MRI to look at the rotator cuff as well. It may indeed need to be fixed and reattached for complete healing. If you've injured your bicep, see a UCHealth CU Sports Medicine orthopedic specialist right away so we can help develop the right treatment plan for you.